Hello guys, so today we are going to talk about the physical diagnosis. So welcome back to another live stream and let's begin. So today we are going to discuss the interviewing in health and how to take the health history. So the health history interview is a conversation with a purpose. As you learn to elicit the patient story, you will draw on many of the interpersonal skills that you use every day, but is unique and important differences. In social conversation, you freely express your own views and are responsible only for yourself. In contrast, the primary goals of the patient interview are to listen and to improve the well-being of patient through a trusting and supportive relationship. Okay. So, um, relating effectively with patient is among the most valued skills of a clinical care. For the patient, a feeling of connectedness, of being deeply heard and understood, is the very heart of healing. For the clinician, this deeper relationship enriches the rewards of patient's care. High quality patient clinician communication has also been shown to improve patient outcomes, decrease symptoms, improve functional status, reduce litigation, and decrease errors. The interview is also the most commonly performed clinical intervention occurring to thousands of times in a clinician's career. These are all salient and compelling reasons to develop expertise in this skill. This chapter introduces to the essentials of interviewing and establishing the trust, the foundation of your therapeutic alliance with patients. At first, you will focus on gathering information, but with experience and empathic listening, you will allow the patient story to unfold in its most authentic and detailed form. Okay. Interviewing is both a skill and an art. Skill interviewing is both patient-centered and clinician-centered. Okay, so the interviewing there are two types of interview. First is the patient-oriented, and second is the clinician-oriented. Clinician. Okay. So the clinician must focus on patient on to elicit the full story of the patient's symptom. But the clinician must also interpret key information to reach the assessment plan. Patient-centered interviews recognize the importance of patient expression of personal concerns, feelings, and emotions, and evoke the patient context of the patient's symptoms and disease. Experts have defined patient-centered interviewing as the following: as following the patient's lead to understand their thoughts, ideas, concerns, and requests without adding additional information from the clinician's perspective. In contrast, in the more symptom-focused clinician-centered approach, the clinician takes charge of the interaction to meet her or his own need to acquire the symptoms, their details, and other data that will help her or him identify a disease, which can bypass the personal dimensions of the illness. Evidence suggests that the patient is best served by integrating these interviewing styles, leading to a more complete picture of the patient's illness and allowing clinician to more fully convey the caring attributes of respect, empathy, humility, and sensitivity. Current evidence shows that this approach is not only more satisfying for the patient and the clinician, but also more effective in achieving desired health outcomes. Okay. The interview process is quite different from the format of the health history. The interview is more than just a series of questions. It requires a highly refines sensitivity to the patient's feeling and behavioral cues. The health history format provides an important framework for organizing the patient story into various categories pertinent to the patient's present, past, and family health. The interview and the health history format have distinct but complementary purposes. Keep these differences in mind as you learn the techniques of skilled interviewing. So the interviewing process generates the patient story is fluid and draws on numerous relational skills to respond effectively to patients' cues, feelings, and concerns. The adaptability of the interviewer has been compared to to the improvisation of jazz musicians who listen attentively to notes and themes and play to each other's cues. The in the moment flexibility lets the interviewer adapt to patient's lead as the story unfolds. The interview should be open-ended, okay, drawing on a range of techniques to cue patients to tell their stories. Active listening, guided questioning, non-verbal affirmation, empathic responses, validation, reassurance, and partnering. These techniques are especially valuable when eliciting the patient's chief concerns and the history of the present illness. The health history format is a structured framework for organizing patients' information in written or verbal form. This format focuses on your attention on the specific kinds of information you need to obtain, facilitates clinical reasoning and standardizes communication to other healthcare providers. Hmm, okay. the the past medical history, the family history, the personal and social history, and review of systems gives shape and depth to the patient story. The personal and social history is an opportunity for the clinician to see the patient as a person and gain deeper understanding of the patient's outlook and background. Learning about the patient's life circumstances, emotional health, perception of the healthcare, health behaviors, and access to and utilization of healthcare strengthens your therapeutic alliance and improves health outcomes. Make every effort to limit the clinician-centered, closed-ended yes or no questions to the review system. Okay, so we should avoid the yes and no type of questions. Okay. Above all, skilled interviewing requires your lifelong commitment to masterful listening, easily sacrifice to the time pressures of daily healthcare. In the words of Sir William Osler, one of our greatest clinician and co-founder of Johns Hopkins School of Medicine in 1893, listen to a patient, he's telling you the diagnosis, and the good physician treats the great physician, treat. Oh, fuck. This is important. So, this Sir William Osler, he gave some statement, or you can say the proverb that says the listen to a patient, he is telling you the diagnosis, and the good physician treats the disease. The great physician treats the poor patient who has the disease. Different kinds of health histories. So okay, so for new patient, in most settings, you will do a comprehensive health history. For patients seeking care for specific concerns, for example, cough or painful urination, a more limited interview tailored to that to that specific problem may be indicated. That this is sometimes known as a focus or problem oriented history. For patients seeking care for ongoing to chronic problems, focusing on patient self management, response to treatment, functional capacity, and quality of life is most appropriate. Patients frequently schedule health maintenance visits with the more focused goals of keeping up screening examination or discussing concerns about smoking, weight loss, or sexual behavior. That specialists may need a more comprehensive history to evaluate a problem with numerous possible causes. By knowing the content and relevance of the different components of the comprehensive health history, you are able to see the elements most pertinent to the visit and shared goals for the patient's health. This chapter sets guideposts for interviewing and health history outline below. Okay. Sorry. Okay. So fundamentals of a skilled interviewing, the sequence and context of interview. So, in the case of fundamentals of skill interviewing, we have the techniques of skill interviewing, active listening, empathic response, guided questioning, non-verbal communication, validation, reassurance, partnering, summarization, transitions, and empowering the patient. The sequences and the context of the interview. Preparation, reviewing the clinical record, setting goals for the interview, reviewing your clinical behavior and appearance, adjusting the environment, the sequence of the interview. So, greeting the patient and establishing a rapport, taking notes, establishing the agenda for the interview, inviting the patient's story, identifying and responding to emotional cues, expanding and clarifying the patient's story, generating and testing diagnostic hypothesis, sharing the treatment plan, closing the interview and the visit, taking time for self-reflection. The cultural context of the interview, demonstrating cultural humility, a changing paradigm. And advanced interviewing, challenging patient, the silent patient, the confusing patient, the patient with impaired capacity, the talkative patient, the angry or disruptive patient, the patient with a language barrier, the patient with with the low literacy or low health. Okay, the hearing impaired patient, the blind patient, the patient with limited intelligence, the patient seeking a personal advice, the sedated patient. See, sensitive topics, the sexual history, the mental health history, alcohol and prescribed and illicit drug use, intimate partner and violence, family death and dying, ethics and professionalism. So we have how many? These are 1, 2, 3, 4, 5, 10. So we have 10 steps in the skill interview technique. So first is the active listening. Then second is the empathic response. Third is the guided coaching. Then fourth is the non-verbal communication. Then fifth is the validation. Then sixth is the reassurance, partnering, summarization, transitions, and empowering the patients. Okay. So first we have the active listening, and then emphasis, empathic responses. Okay. Then guided questioning, non-verbal communication, validation, reassurance. Okay. So A, E, G, and V. No, this is not going to work. So guys, I first of all, so whenever there is list, I make a acronym for it, starting with the initials so see, I'll make a statement like this. Socrates was the genius in his family in order to top the class. So, so what do you understand from this? So, S is for the species, G is for the genus, family, family, in order to top the class. Okay, so but in this case it is not working. Active listening, empathic responses, guided questioning, non-verbal communication, validation, reassurance, partnering, summarization, transitions, and empowering the patient. Okay. Okay. Active listening lies at the heart of the patient interview. Active listening means closely attending to what the patient is communicating, connecting to the patient's emotional state, and using verbal and non-verbal skills to encourage the patient to expand on his or her feelings and concerns. Active listening allows you to relate to those concerns at multiple levels of the patient's experience. This takes place. This takes practice. Practice. Yeah. It is easy to drift into thinking about your next question or possible diagnosis and lose your concentration on on the patient's story. Focus on what the patient is telling you, both verbally and non-verbally. Sometimes your body language tells a different story. Hmm. Empathy responses. So, empathic responses are vital to patient rapport and healing. Empathy has been described as the capacity to identify with the patient and feel the patient's pain as your own, then respond in a supportive manner. Okay. Empathy requires a willingness to suffer some of patient's pain. In sharing or suffering, this is vital. That is vital to healing. As patients talk with you, they may convey in their words or facial expression. Feeling they have not consciously acknowledged these feelings are crucial for to understanding their illness. Sorry guys. So to express empathy, you must first recognize the patient's feeling and then actively move toward and elicit emotional content. At first, exploring these feelings may make you feel uncomfortable, but your empathic responses will deepen mutual trust. Guiding questions options for expanding and clarifying this patient story. So, there are several ways to elicit more information without changing the flow of the patient story. Your goal is to facilitate full communication in the patient's own words without interruption. Guided questions show your sustained interest in the patient's feeling and deepest disclosures. They help you avoid questions that pre-structure or even shut down the patient's responses. A series of yes or no questions make the patient feel more restricted and passive, leading to significant loss of detail. Instead, use guiding questions to absorb the patient's techniques. So, what are the techniques of guided questioning? Guided questioning. So, moving from open-ended to focus questions, using questioning that elicits a graded response, asking a series of questions one at a time, offering multiple choices for answers, clarifying what the patient means, encouraging with the continuous and using echoing. Okay, so let's assume that you are patient and I am not. So, you are telling me a story about your pain in the abdomen. Okay. So you are telling like, yes doctor, I am having some pain in the abdomen, and can you treat? Fuck. Why? Okay. So you come to me and you basically complain about the pain in the abdomen. Okay. So So you are telling me a story, okay? So I will use open-ended questions to to broaden your imagination. Okay. Then then I'll give you some multiple choice questions like do you feel the pain in right upper quadrant or here by just showing by just showing with my hands where do you feel like yeah. Then okay. Then I'll ask him questions about this pain, and I will reassure that whatever he's saying is right. Okay. For example, if he tells that I am having a serious pain in the right upper quadrant, so I will again ask him, do you have a pain in right upper quadrant of your liver? So he'll say yes. So I will again say, are you sure? Then he will say, yes, doctor, of course. Then I will confirm that he has this pain in the right upper quadrant. This is called echoing. So, moving from open-ended to focus questions, your questions should flow from general to a specific. Think about a cone, one open at the top, then tapering at a focal point. Start with the most general question like "How can I help?" or "What brings you in today?" Then move to still open, more focused. Okay. Can you tell me more about what happened when you took the medicine? Then pose clone question like, did the new medicine cause any problems? Oh, okay. Begin with the truly open-ended question that does not prefigure an answer, and a possible sequence might be, tell me about chest discomfort. Pause. What else? Where did you feel it? Pause. Show me. Anywhere else? Did you travel to which arm? Okay. Our leading question that already contains an answer or suggested response like, has your pain been improving or you don't have any do you? If you ask, is your pain like pressure and the patient answers yes, the patient response is okay. So we should ask the more general questions, not the specific ones. Like please describe your pain. So patient will describe like how is it? Is it like blunting pain or is it like pressured pain? Yeah. Questions that elicits a graded response. Ask questions that require a graded response rather than a yes or no question. How many steps can you climb before you get fed up? Is better than do you? Okay. How many steps can you climb before you get short is better than do you get short? Okay. So we are measuring the quality of the disease that the patient has by asking him how many steps can you climb before you get short of breath. Asking a series of questions one at a time. Be sure to ask one question at a time. In any tuberculosis, pleurosis, asthma, bronchitis, pneumonia, no. Try. Do you have any funny problems? Be sure to pause. Offer multiple choice questions for answers. Sometimes patients need help describing the symptoms. To minimize bias, offer MCQs. Which of the following words best describe the pain? Itching, sharp, pressuring, burning, shooting, or something. Almost. Hmm. Okay. Clarifying what the patient means. Okay. Sometimes the patient's history is difficult to understand. It is better to acknowledge confusion than to act like the story makes sense. Hmm. Okay. Tell me exactly what you mean by the flu, or you said you were behaving just like your mother. What did you mean? Taking time for clarification reassures the patient that you want to understand his or her story and build your therapeutic relationship. Encouraging with context. Without even speaking, you can use postures, gestures, or words to encourage the patient to say more. Pausing and nodding your head or remain silent. Leaning forward, making eye contact, and using phrases like go on, I'm listening, all enhance the flow of patient history story. Echoing. So, simply speaking, the patient's last word or echoing engages the patient to elaborate on details and feelings. Echoing also demonstrates careful listening and the subtle connection with the patient by using the same words. For example, the patient. The pain got worse and began to spread. Spread? Yes, it went to my shoulder and down my left arm to fingers. It was so bad that I thought I was going to die. Yes, it was just like my father had when he had his heart attack, and I was. The reflective technique helped to reveal not only the location and severity of the palm pain, but also the meaning of the patient. It did not bias the story of or interrupt the patient's train of thought. So non-verbal communication, both clinician and patient continuously display non-verbal communication that provide important clues for to your underlying feeling. Being sensitive to non-verbal cues allows you to read the patient more effectively and send messages of your own. Pay close attention to eye contact, facial expression, posture, head position, and movements such as shaking or nodding, interpersonal distance, and placement of the arms or legs, crossed, neutral, or open. Be aware that some forms of non-verbal communication. Hmm. Okay. Just as mirroring your posture shows the patient's sense of communication connection, matching your position to the patient can transmit increased rapport. You can also mirror the patient's para paralanguage or quality of speech, such as pacing, tone, and volume, moving closer to or making physical contact like placing your hand on the patient's shoulder. The first step to using this important technique is to notice non-verbal behaviors and bring them to conscious levels. Validation. So another way to affirm the patient is to validate the legitimacy of his or her emotional experience. A patient's A patient caught in a car accident, even if uninjured, may still feel very distressed. Saying something like, "Your accident must have been very scary." Car accidents are always unsettling because they remind us how vulnerable we are. Well, hmm. Okay. So we should, give some empathy towards patient. Like this happened, and this is not dangerous, and this is not like end of all, and you can live all this stuff. So reassurance. When patients are anxious or upset, it is tempting to provide reassurance like, don't worry, everything is going to although this is common in social interaction. For clinicians, such comments may be premature and counterproductive, depending on the actual situation. They may be they may even be misleading and block further disclosure. The patient may sense that you are uncomfortable. The first step, the first step to effective reassurance is simply identifying and acknowledging the patient's feeling. For example, you might simply say, "You seem upset today." This promotes a feeling of, of connection. Meaningful reassurance comes later. After you have completed the interview, the physical examination, and perhaps some laboratory tests. At that point, you can explain what you think is happening and deal openly with any concerns. Reassurance is more appropriate when the patient feels that hmm, partnering. So, when building rapport with patients, express your commitment to an ongoing relationship. Make patients feel that no matter what happens, you will continue. Hmm. This support can make big difference. Summarization: giving a capsule summary of the patient's story during the course of interview serves several purposes. It communicates that you have been listening carefully. It identifies that what you know and what you don't know. Let me make sure I have a full story. You said you have had cough for 3 days. That it's it's especially bad at night, and that you have started to bring up yellow phlegm. You have not had a fever or felt short of breath, but you do feel congested with difficulty breathing through your nose. Following with an attentive phase, pause, or asking anything else. Let's be. Hmm. Okay. So you can use summarization at different points in the interview to structure the visit, especially at times of transition. This technique also allows you to organize your clinical reasoning and convey your thinking to the patient, making the relationship make more collaborative. It also helps learners when they draw a blank on what to ask next. Transitions. Patients may be apprehensive during a healthcare visit. To put them more at ease, tell me, tell them when you are changing directions during the interview. Just like signs along the highway, signposting transition help prepare patients for what comes next. As you move through the history and, and on to the physical examination, orient the patient with brief transition phrases like now I would like to ask some question about of fuck. Now I would like to ask some questions about your past health. Make clear what patient should expect or do before we move on to reviewing all your Now, I would like to examine you. I will step out. So, empowering the patient. The clinician patient relationship is inherently unequal. Your feelings of inexperience as a student, predictability Hmm. change over time as you grow in a clinical experience. Patients, however, have many reasons to feel vulnerable. They may be in pain or worried about the symptom. They may feel overwhelmed by events, a task you might take for granted. Differences of gender, ethnicity, race, or socioeconomic status contribute to the to the power asymmetry of the relationship. Ultimately, however, patients are uh, responsible for their own care. When you empower patients to ask questions, express their concerns, and probe your recommendation, they are most likely to adopt your advice, make lifestyle changes, or to make or take medications as prescribed. Okay. So, empowering the patient, the patient technique for sharing purpose, evoke the patient perspective, convey intention person, not just a problem, follow the patient's lead, elicit and validate emotional content, share information with the patient, especially at transition point during the visit, make your clinical reasoning transparent to the patient, reveal the limits of your knowledge. Okay, guys. So that was it. I'll summarize by whatever I said in this lecture. So in this live stream we learned about the techniques which are required which are required for the doctor to interview the patient effectively. Okay. So there are many steps in the interviewing of the patient. First is the active listening. Second is the empathy, like giving empathy. Then third is like you basically make eye contact with the patient, and yeah, you adjust the tone of your voice according to the patient's belief and the patient's mood. Yeah, the patient might be angry, or he might not know what he has disease, and and yeah, we should use open-ended question first. Then forwards, we should use the close-ended questions. Then the huh. So first of all, we should not disrupt the patient's chain of thought, and we shouldn't disturb any of the patient's story, and yeah. Um, and what am I missing? Yeah, echoing. So you should make sure that the information you get is right. So you should ask the patient for like, is it true that this is, like, do you have a pain in your leg? So he will say yes. So we will tell him that, are you sure? Then he'll say yes. So yeah. And yeah, we should summarize the information that the patient has given us. So this conversation, it embraces a thought in the patient's mind that the doctor is that the doctor is listening to his problems. Okay, and that gives us positive feeling of. So yeah, okay, guys, that was it for today. Thank you. Bye bye.